Alright, so the first thing I'm going to do is I'm going to check my provider orders. According to this, my patient was admitted for ED, severe abdominal pain related to small bowel obstruction, dehydration, nausea, and vomiting. He has signed informed consent and has an order to place an NG tube. So that would make sense for my patient. I'm going to gather my supplies, make sure I double check for any allergies, which he does have an allergy to Demerol, but that shouldn't be too big a deal. So all of my supplies are gathered, and then now for the privacy. Hi, my name is Ellie. I'm a nursing student from St. Martin's. Can you tell me your name and your date of birth? And I'm going to double check that with his bracelet. Alright, Mr. Sam, perfect. Your provider has ordered that I put in an NG tube because he's been experiencing some nausea and vomiting from your small bowel obstruction. Do you have any questions about the procedure? No? You consent to me putting in an NG tube? Yes? Okay, perfect. Do you have any history of gastric bypass, any nasal or facial surgeries, frequent nosebleeds, esophageal varices, anything like that? No? Perfect. So the first thing I'm going to do is I'm going to sit you up a little bit. Alright, is that comfortable for you? Okay. Then I would perform hand hygiene when I was coming indoors. I don't remember if I did or not, so I'm going to do it again. And I'm going to put on some gloves. And set the table. First thing I'm going to do is I'm going to assess the nurse for patency. Alright, breathe in and out for me. And breathe in and out for me. Alright, does one feel better than the other? No? Alright, I'm going to go ahead and put it in your right nostril. I'm also going to make sure I take his vitals and attach a pulse ox before I begin to monitor his vital signs and especially his oxygen saturation while I'm doing this. If they tank, then I will stop the procedure and call the provider. I also want to assess his gag reflex, which I have already done before I start. I'm going to start sitting up. This was not the towel I thought it was, but that's okay. Put this here. I'm going to make sure you may experience some discomfort, some nausea. You may gag a little bit or cough, and that's totally fine. If it gets too much to handle, let me know. Just tap, and I will stop. And we can try again some other time, okay? Alright, so now that I've done that, I have given him an Ennis basin, put the towel in place. There is also a waterproof pad underneath him. I'm also going to bring my cup of water and give that to him with a straw in it. We don't have any straws, so we're going to put him that has a straw in it for the later part of the procedure. Then I'd like to change my gloves, which start hand hygiene. I also want to make sure I offer him either lidocaine spray or an Ativan to calm him down a little bit because this procedure is pretty invasive and uncomfortable. And then lastly, before I start, I am going to raise the bed to a comfortable height for me. I should have done before I put the away. Alrighty, in my bag, I want to make sure I have already clamped the reflex valve. And the first thing I'm going to do is measure it. So from his nose to his ear, and then down to the dilate process, which is about here. And I'm gonna mark it with my pen or permanent marker. Next thing I'm gonna do is I'm gonna apply some lubricant spray to the end of the spout. Spray very hard. Alright, Stan, so here's what we're gonna do. I'm gonna have you tip your head back a little bit. And then, as I get it in, I'm gonna have you tilt your chin forward and start drinking out of that cup of water, okay? Alright. Ready? 1, 2, 3. Head back. Alright, and now tip your chin forward and start taking sips of that water. And I'm gonna advance it with each sip he's taking to help it go down. Alright, great job. Then I'm going to secure it loosely. If I can get the tape to, I'm going to secure it loosely to his cheek. And then send him to radiology to go get an x-ray just to double check placement. Which is the most evidence-based form of doing so, but I can also ask for a pH of the acid return, and it should be below 5 if it's in his stomach. So once he comes back from x-ray and it has been placed, I'm going to redo the taping, so it's a little bit more comfortable. And I want to make sure that he has enough room to go around a little bit without pulling on it. I'm also going to secure it to his gown with a safety pin, but I'm using tape. So that's all I got. Alright, I'm going to remove all this. Take off my gloves. Perform hand hygiene. And put on a new pair of gloves before having clean around the nostril with some mild soap and warm water. We'll provide oral care if that's what you would like. Alright, Mr. Stan, you did a great job. Do you have any questions for me before I go? No? Alright, just make sure you don't tug on the tube. If you start feeling a little funky, let me know, and I'll come back in and check on you in about an hour, okay? Alright, perfect. I'm going to clean my supplies, and that should be it, and then I'll leave.